Hello, everybody, and welcome again to our Wisdom Wednesdays webinar. We have again another amazing guest. We have Zia, of course, our COO, Gabi, our business development leader and Q&A queen, and Maria, marketing specialist. And our amazing guest today is Jennifer Cruz. Jennifer, she is the co-founder of Easter Acupuncture and Wellness, and we are very, very excited to have you today. Jennifer, your journey is very inspiring for those who don't know you yet. How would you describe just your story and your mission?
First and foremost, thank you so much for having me. My mission is simply to educate the world on the body's innate ability to repair itself. Eastern medicine, by integrating it into the Western paradigm, we are looking to ultimately create comprehensive, holistic healing to everybody and give them hope, because we're at a time where hope is far, far and few in between.
Wonderful. So, Jennifer, we have some questions, so we're just going to go ahead with those. So, you specialize in everything, right? From autoimmune conditions to fertility. How does traditional Chinese medicine take a different or deeper approach to healing compared to conventional Western models?
Well, I like to say we all get into medicine to help people live in their bodies and function optimally, right? So how Eastern medicine and the approach that's taken is we believe that the body has an innate ability to repair itself, and the whole equals the sum of its parts. So when we look at a person, we look at their lifestyle and their epigenetics, their DNA, and ultimately what they were born with, their family medical history. And then we do traditional Chinese medicine diagnostics by looking at observing the face, the eyes, the skin color, looking at the tongue, feeling the pulse, and then determining acupuncture is a facet of Chinese medicine, and one of the facets that we use and that I'm passionate about bringing to the forefront of medicine, because it's a paradigm that can integrate into Western pharmaceuticals. So with acupuncture, what we do is we choose points throughout the body that can ultimately stimulate blood flow, right? And our body's made up of blood and lymphatic fluid and water. So if we can stimulate blood flow, we can naturally reduce inflammation. And inflammation is the culprit of every disease. So ultimately, how acupuncture works is when we choose an area of the body to put the needle, it tells the brain that there is a foreign object inside of you. So the brain goes and stimulates the heart to pump blood throughout the vessel and the artery to protect the body from the acupuncture needle. And in turn, that circulation throughout the vessels and the arteries and the tendons and the muscles and the joints and the sinews is going to stimulate the cardiovascular system, the pulmonary system, the digestive system, the endocrine system, to have the body function optimally. And then take the nervous system. We have our central nervous system, our brain, and our peripheral nervous system. Take it from that fight or flight in which most of us run our lives in, go, 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 to rest and repair. And in that state, ultimately, everything can go back into homeostasis or balance. So acupuncture can treat from pediatric to geriatric and everything in between, which is why part of our mission is to integrate it into this Western medical paradigm, because if people are functioning optimally, they're going to have less dis-ease, right? And that disease is going to have a domino effect within families and communities.
All right. So if your mission is to educate, I think you just educated a ton of us, because I would say for the average person, acupuncture, they probably think they're just going to stick me a bunch of needles and not realize what's going on. So yeah. I really appreciate understanding that it's more to generate blood flow and to ease inflammation. When would somebody be a candidate, or when would somebody start thinking, maybe I should look into doing something like this?
Well, that's where the education comes in, and really being at the forefront of our medical system. I will say I went in to do for Nurses Week in Memorial Healthcare, and I treated up to 70 employees, physicians, providers, and 64 of them had never tried acupuncture before. With that being said, I think it starts with education. Acupuncture should be used from fertility to gestation through every step. Pediatric, we should have acupuncture in with pediatrics. We should have acupuncture with cardiology, immunology, endocrinology, urology. It should be in every department throughout every system to allow the body first to repair itself before seeing if we need to take another avenue.
So autoimmune is something that I think is going around more and more than we had seen before. I think it's at a height right now. When it comes to autoimmune, and I think it was part of the question that Aleja asked, how can you use acupuncture to assist with or to help overcome autoimmune?
Well, first and foremost, your immune system is compromised of every facet that I just expressed, from your cardiovascular system to your endocrine system. When the nervous system is in a state of homeostasis or balance, the body can reverse any attacking that's going on, and that's what autoimmunity is. It's the body's system dysregulating and attacking itself. So when we provide acupuncture to a patient or we put them on herbs, what that does is it brings the nervous system in balance. It reduces the inflammatory markers that are actually triggering the autoimmunity. So most everything is from inflammation. So reversing that and having the cells ultimately work optimally can trigger trigger the body's resetting.
All right. So with that, and I think this is awesome for people to learn this, because I feel, to use a sports analogy, I feel like Eastern and Western medicine is kind of like Yankees Red Sox, and they just kind of like fight against each other all the time. Is there a reason you can't incorporate the two as in one friendly and I don't know how to use the word friendly, but one kind of treatment option to where we're using both sides?
And that's ultimately what my mission in life is right now, to do exactly that, because it comes from advocacy. It comes from educating. It comes from, going into these conventional systems and showing them and educating them on how we can work together. And it's happening slowly but surely. We actually were one of the first providers to become a community care partner for veterans. And right before COVID, in 2019, before COVID hit, they were performing a clinical trial using the VA for providing acupuncture and providing these veterans who were in pain management to do 12 visits of acupuncture for chronic pain, mostly lower back. And at the end of this trial, it was successful because they implemented in Medicare acupuncture to be covered 12 visits a year for chronic low back pain. And then it extended from there. We did it for osteoarthritis of the knees, joint pain, neck pain, thoracic pain, neuropathies. So more and more diseases are being covered through our Western paradigm, where that's where the integration is coming together.
So as long as insurance is willing to pay for it, that's when you're going to have more and more acceptance of it.
100%.
So it's kind of like Bitcoin, right? Once more and more people accept it as payment, the more likely it is to get more adoption. All right, I see. I like it.
I have here a different question, changing a little bit of topic. It's more for Dr. Junior. So what part of your personality do you think has helped you the most in building what you have built today?
Well, I am stubborn. I am stubborn, determined, and driven, and passionate. I'm passionate about this mission, and I am determined to be the change in our system and to bring the two paradigms together. And with that, I think has really allowed me to go from two practitioner practice to 7 amazing physicians, 8 board certified massage therapists, 8 patient advocates that are just as passionate about this mission as I am. And Eastern Acupuncture and Wellness has really created a life of its own that is knocking down doors, as well as we have a nonprofit called AcuMantras. And when COVID hit, a lot of our patients lost their health insurance and their jobs. So we created a platform that brought accessibility, affordability, and education of East Asian medicine to the forefront of the communities. Accessibility because of our endorsed community clinic program to bring low cost or no cost for veterans and anybody, especially first responders, to be able to receive this as an option. And that was part of my determination. And I think that I just keep on.
A stubborn New Yorker, I never would have imagined.
You're right.
Jennifer, you co-founded, Acupuncture, your company, in 2014.
Yeah.
And also you launched AcuMantras, correct? During the pandemic. So what's the difference between both of them, AcuMantras and Eastern Acupuncture and Wellness? And during the pandemic, how was that process? People were locked down. So how was your business going?
Well, I was fortunate to be a part of an organization, entrepreneurial organization, that as soon as the pandemic hit, there were all hands in. And we were able to get protective equipment immediately within 2 weeks. We shut down for 2 weeks and then we reopened. We were able to provide as much care for those that were, fearless enough to come out and receive it. And the challenge that we came across was that a lot of our patients, to receive that continuity of care, they had lost their jobs. They were scared. And the community acupuncture gave them an avenue in which they can come in, receive treatment at no cost or low cost. And Eastern Acupuncture and Wellness is a primary care platform. So we take insurance. Our providers are primary care providers specializing in acupuncture and oriental medicine. So you come into that setting and it is, it's looking at blood work, looking at any other diagnostics. You're with a practitioner one-on-one for an hour and a half and receiving anything from acupuncture to herbal medicine to nutritional counseling to dietary counseling. So it encompasses everything, where AcuMantras is more really TCM. We're looking at the pulse, we're feeling the pulse, we're looking at the tongue, we're asking what symptoms are transpiring, and then we're immediately treating.
Okay. So you've brought up tongue numerous times. Pulse, I can understand. What's going on with the tongue?
So if somebody has a stroke, the tongue will deviate. If somebody has a heart attack, the tongue will go purple. The tongue tells us everything that's going on. The tip of the tongue shows us the lung and the heart. Depending on the color of it, we can tell what's going on or what's transpiring. If there's more phlegm or mucus or blockages, the sides of the tongue show us the liver and the gallbladder, which your liver recycles all the blood in the body every 60 seconds. So it regulates the endocrine system, hormones, adrenals, thyroid. So the sides of the tongue will tell us if the blood isn't flowing optimally throughout the liver. If there is anything going on with the gallbladder, if the body can't convert fats. The middle of the tongue shows us the digestive system, the large intestine, the small intestine, the stomach. The back of the tongue shows us the kidneys, the urinary bladder. The overall color of the tongue will determine how much blood flow or circulation is going on in the body. And actually, in regards to the pulse, once we look at the tongue, we feel the pulse. The right pulse will tell us what's going on with the pulmonary system and the digestive system in the right kidney. The left pulse tells us the cardiovascular system and the endocrine system, as well as the left kidney. So we're not just feeling how many beats per minute or how fast or slow the pulse is.
All right. So I'm going to just go on a limb, and I'm going to say everybody who just heard that was rolling their tongue around in their mouth while you were talking. Because I know I was doing it. I'm like, all right, what's going on in there? And there can't be a person listening to this who doesn't want to schedule an appointment, obviously take an Altoid first or some sort of binocular and be like, all right, if she's going to check out my tongue, I can't stink like I just had a bag of chips. It's super interesting because I don't think most people would have known that looking at your own tongue, you can identify that many things. So I think it's like super cool that you bring this up. Like you wanted to educate, you want to do it inform people. Just like little talks like this may trigger somebody to go on YouTube afterwards and just like, what does the tongue do? And then, just like educate, like, because that's how I learned everything is through YouTube University. I mean, I went through a traditional school for too many years, and I learned everything on YouTube. Somebody will say something like, what the hell was that? Let me look that up. Now it's all ChatGPT, but still, it's like really cool. Like you bringing this up. And I think you're going to see like a lot of people who are listening to this going to be like, one, they're probably going to call you because they're probably sick of primary care. They're on too many meds. They're on this pill. They're on that pill. They're on a pill to overcome the other pill's side effects. And everybody's at a point now where I'm like, well, let me try something different and see if I get better results. And you brought up the word dietary. And I'm a huge believer in diet and exercise are the two most responsible things a human can do. Because if you're not exercising, especially as you get older, I'm like a huge advocate of the older you get, don't stop lifting weights, lift more of them because your body needs the muscle mass to sustain yourself. And then two, your food is like, it's like the gasoline you put in your car. If you drive a Maserati, you drive a Lamborghini, why would you put regular unleaded in there? You got to put super premium in there. So I'm a big advocate. I'd love for you to expand because I think we've had enough of these conversations where I talk about like diet and exercise, but I'd love to hear it from from an Eastern medicine point of view of like, what should we be putting in our bodies? What should we be avoiding? And what are your thoughts on exercise?
Well, thank you for asking that. First and foremost, food is medicine. That is the only thing that we need. If we didn't eat or drink, we would die, right? Yeah. So what we eat and drink and how our body can convert it and utilize it is how we're going to thrive. We take many approaches to food because, our environment is full of free radicals. And when those free radicals enter our system, it reduces our antioxidant function. And our antioxidant function is what keeps our immune system strong. So I mean, it's pretty redundant. I'm sure everybody has heard this many times, but I advise my patients first and foremost to eat the perimeter of the store. Eat organic as much as possible. It's not gonna guarantee, but it's going to help with, reducing the amount of genetically modified foods or chemicals that are going to be in those foods. I like to say sugar before noon, good sugars, for instance, your fruits, not mixing fruits and proteins or carbohydrates because especially proteins, it converts the protein into a carbohydrate. So fruits before noon and, for those afternoon, vegetables, as many vegetables as you can get in, healthy proteins, with proteins, free range. I am all about moderation. I am a pescatarian, but I've been through phases where I was an omnivore, I was a vegetarian, I was a vegan. And I think that that was very helpful at different phases of my journey because it resets the system. Our gut is our second brain. Our microbiome is everything. And to build a strong microbiome, giving your body the foods that are going to support your lifestyle is so important. Does that answer your question? And
it does, but it unfortunately triggered another one, and I know I'm going to get scolded at afterwards. But okay, so in the last 5 years, we have seen some crazy elaborations on diets. And for example, I remember 5-6 years ago, keto was like the big thing. Everybody went keto. Then people went vegan, and now there's carnivores just going crazy. Then there's an animal-based one that you can incorporate a couple of more things. And it's funny. I look at all of them, and I want your thoughts on this. I look at all of them, and it just looks like when you commit to any one of those, what you're really doing is you're just not putting crap in your body anymore, right? If you're vegan, you're not eating a bag of potato chips, deep fried chicken. You're not eating, you're not eating crap anymore. And even when you go carnivore, like I have a friend of mine who weighed 250, he's down to 170, and his doctors told him, "We don't know what you did, but you're in the best shape you've ever seen you in." Now his lifestyle's miserable because he eats like steak for every meal of the day, and I'm like, I just can't do that. But when you look at it, they just cut out so much garbage from their diets that they go into a thing. But I wanted to ask you, clearly somebody who's got more letters after the name than I do. What is the ideal diet for the body?
See, and that's where Eastern medicine takes a different approach than Western. There's no one size fits all at the end of the day. If we look at our genetics, we look at our epigenetics, we look at our lifestyle and what's going to support our lifestyle. That's what's going to function. That's what's going to ultimately help the body function optimally. So it really depends on the person.
Okay. Just less crap, everything in moderation.
I also, for those that have exhausted every avenue and just don't know what to do or what's affecting them, and they're having digestive issues and they're having diarrhea or constipation, they're having acid reflux, they're feeling really stressed, so on and so forth, and they've tried everything, I will use advanced laboratory testing, because we can look at what things are triggering inflammatory markers. You could have somebody who's eating an apple every day. I happen to be allergic to apples. Did I know that? No. I was like, what is going on with me? And I went and I did some ALCAT testing and looked at all of my markers. And in turn, it turned out apples was one of the things that was high inflammatory for me and triggering a domino effect of all these cascade effect of all these other things and symptoms, which creating inflammation. And then that inflammation goes into the joints. And why was my knee bothering me and my shoulder bothering me? Is because I was constantly eating something that was creating inflammation, even though it's healthy, even though I was juicing it with celery and cucumber and, chia seeds and flax seeds and doing the whole thing.
Is that something you offer?
Yes. Yes.
See, I think that's something big that most people don't realize. Like, they're eating something healthy that their body's like, yeah, it might be healthy for everybody else, but not for you.
And that's where Google doesn't really do us, doesn't give us the best advice at times because it's tailored for the one shoe.
Mm-hmm. Agreed. And before I get in trouble, let me turn it back over to
No, that's good. You're good. Jennifer, so you were talking about, Eastern medicine and Western medicine, and they're completely different. How do you see the future for both of these ones? What do you think is going to be for the Western and for the Eastern? Is there something completely different for the future?
I see there being Eastern medicine in every institution, from primary care settings to each specialty, where there will be an acupuncturist or a traditional Chinese medicine practitioner or a doctor of acupuncture and oriental medicine on staff, and doctors working together for the patient. Not that you're sent to a cardiologist and the endocrinologist is putting you on thyroid medication that's causing AFib. And again, that's just an example. That's not the case. But I see us being integrated into a Western medical paradigm sooner than later.
Awesome.
Can I ask a question?
Of course, I was gonna, go.
Okay, so has your definition of healing changed over the years? If so, how?
When I first started practicing Oriental medicine and learning it, a doctor had told me, one of my teachers, you should become comfortable being uncomfortable, because being at the forefront of of traditional Chinese medicine in a Western society is very uncomfortable because it's like I'm speaking another language. And I think that the more people that I have put my hands on and my practitioners have worked with, and the more people I've seen walk out of the practice with hope, and the more physicians that we've worked with to titrate our patients off of medications and just see their quality of life change, helps me to continue to want to learn and learn more, because the more we learn, the less we know. So I think that that's where I am. I'm currently working on on defending my thesis dissertation in Shanghai in December, and it's clinical immunology. It's post-COVID long haulers and Chinese medicine to again improve and increase immunity. And all of my physicians the same. Anybody who works at Eastern Acupuncture and Wellness, they are continuing to educate themselves, and they're either working on doctorates, their postdoctorates, their advanced training. So yeah, I think education and continuing to learn.
All right. So something that I want to segue into is, so we've talked a lot about what you've done, how you've built it, and what your beliefs are. And I want to pivot this just a little bit into business. You have 2 offices now. You've got, I think you said 7 physicians working with you. How much time are you spending in the business versus how much time are you spending on the business?
It's a great question. Well, there's 24 hours in a day, so I'm doing about 23 of those between in and on. No. I see patients 4 to 5 days a week. And I would say 70%, I don't know, 60, 70% in the practice, and 30, 40% on the practice. And that's where I'm pivoting now. I'm only in plantation one day, but I'm there from open to close. It's so hard because I love what I love patient care. Although I know to reach, to have a further reach, it's going to take working on it a little bit more. But I'm humbled to have an amazing team of physicians that treat me. And yeah, so I'm working on less time or more time working on it so we could expand our reach.
Good luck. It is one of the most difficult things a business owner will do. It's a conversation I have every single day. Yep. Because they're so involved in the day-to-day that they forget while they're doing that, they're not expanding. They're just keeping up with. And it's one of those things where one of my friends has he owns a print shop, and they just do the large scale banners. Like they'll do billboards and they'll do wraps around fences. And every day he's working in the business. And I looked at him like, so when's the next step? When are you going to grow? He goes, I don't have time to grow. And I told him, well, that you have to find somebody that can replace you, or you have to find a way to grow. And it's a conversation that I have like on an everyday basis, because it's such a hard thing when you've been doing for something for so long, so well, so successfully. How do I ask somebody else to do that? And
I'm going to say I'm definitely a visionary, and I know that it's going to take a village to really execute this mission. Mm-hmm. So my main goal is bringing on team members that are aligned with this mission and that have the skills, expertise, and conviction to continue to want to be the change and educate themselves. And so far, I'm humbled by the team that I have walking beside me and walking with me. I love
to have that, because I'm in the same boat here, where I'm like thrilled with who we brought on, we've been able to create such a strong nucleus here. And, Gabby and Aleja being two of them, they're incredible. They make my life so much easier. And one of the things that I've had to do that's super difficult is not just delegate, but to actually delegate and let them do without like micromanaging, being on top of them. And when you find people you can do that with, it's incredibly valuable. So I'm happy that you found that. And I'm hoping you continue to develop more and more of those people for what you're doing, because I think it's invaluable to what we do in medicine. So good luck.
Thank you. It's all about empowerment, right? If we can empower those around us, we can continue to foster the mission.
Love it. Love it.
Jennifer, so you have a book, a teacher, a philosophy, or a mantra, or something that you want to share with us, that has helped healing, with the healing journey, and also your role as a leader, and also transforming healthcare?
So I am definitely a strong advocate. My mantra would be is the body has the ability to heal itself. And that is what my team believes. And that is their conviction. And that is what we are screaming from the rooftops. So I would say that is my mantra. I do a lot of chanting as well. It helps to reduce stress and anxiety and bring the nervous system into that state of relaxation. And let me tell you, even before coming on today, I get a little nervous, and I had to do some acupuncture on myself and do some chanting and the whole shebang to come sit here. I have needles in my feet right now. No. That was the first part of the question. What was your second part, Maria?
What was the second
Gabby,
part of that?
I think we have some questions.
No, it was you answered it good. Don't worry.
Okay.
So we have our last question, sadly. What kind of example do you hope to set for future women in the fields of medicine or wellness?
What kind of example? Conviction. I've said it a couple of times today. Conviction in my mission and really walking authentically with integrity to empower people to take their health in their own hands, to educate themselves, and to really believe that they can heal themselves with lifestyle changes and with awareness and hope. Yeah.
Awesome. Jennifer, we at the end of every podcast we have a game for you, and also see as well, you can always participate. It's a quick questions, and you just have to make a decision between one or the other. So Gabby, you ready?
Yes.
Let's go.
Also, if Sia wants to participate, it's fine. So, what do you prefer, herbal tea or green juice?
Herbal tea.
Yeah.
Green juice.
Do you prefer morning meditation or evening journaling?
Morning meditation.
Bourbon.
Needles or cupping?
Needles.
I'm a virgin to both.
Okay.
Yeah.
Or podcast?
What was the first one?
Books.
Books or podcasts?
Yeah.
Podcast gets out to the world. Books. Oh, for me, books, reading.
I like podcasts because I can do them at the gym.
Okay. Nature walk or gym workout?
Nature walk.
There's a place for both.
Yeah, you too, no? You prefer to nature walk. If you weren't a healer, you were a teacher or a chef?
Teacher.
Chief.
And finally, one word to describe your vibe right now.
Chill.
Enthused. I'm looking forward to this. I want to learn more about this.
Good, you're coming in.
I'll be on that table. Get like as many needles ready as possible.
Less is more.
Jennifer, what are you located? Where can people go and find you? And yeah, so we want to share this with people that are watching right now.
Oh, fantastic. We have 2 locations, one in Plantation and one in Wilton Manors, Florida.
Awesome. So guys, those that you guys are watching, and I'm also going to share your LinkedIn and your page to our social media channels. So please go ahead and check it out. They have an amazing page with everything that they do. So Jennifer, thank you so much for this very educating podcast today. And thank you for your feedback and for everything. Zia, thank you as always for your comments. Gavi, thank you for taking care of questions. Thank you for your questions, guys. Stay tuned. We have more webinars coming soon. This was amazing. Thank you, Jennifer. Thank you so much, guys. Till the next one.
Thank you all so much.
Pleasure, ladies.
Bye-bye.
Bye, guys.